What did Dr. Casey Means say to the Senate about the state of our healthcare system and chronic diseases? I'm Dr. Chad Swanson. I'm an emergency physician, and this is our 5-minute daily health systems transformation conversation. Dr. Casey Means is a Stanford educated and trained physician who decided to take a completely different course in her career away from surgery and towards health, wellness, nutrition, and prevention. About a week and a half, 2 weeks ago, she was part of a roundtable panel for the Senate to talk about the state of chronic disease in our country and the importance of prevention and nutrition. Let me share a few of the words that she had to say. She said, as a physician, the message that I'm here to share is this: American health is getting destroyed due to preventable chronic disease. If current trends continue, we could be facing profound societal instability and decreased American competitiveness at best, and a genocidal level health collapse at worst. She went on to say, it is not an overstatement to say that I learned virtually nothing at Stanford Medical School about the tens of thousands of scientific papers that elucidate the root causes of why American health is plummeting and how environmental factors are causing this. Now, while I don't agree necessarily with all of the conclusions that Dr. Means has made, and I do think that she may be overstating some of her claims, I do appreciate the overall message, her passion, and the need for transformational change. I'll leave a link to her roundtable presentation, as well as others that were given. Here's a few other websites or ideas that I've been listening to and reading in the recent few days. So this is a video. It's just called A Terrible Guide to the Terrible Terminology of U.S. Health Insurance. It's an entertaining and humorous video that's about an hour long, I think, by Brian David Gilbert, I believe is his name. I'd never heard of him before. I have no ties to him, but I found this to be a great introduction to our health insurance system, which really doesn't make sense on so many levels. And we need urgent reform just to understand it. I am in favor of basic, universal, free health insurance. I've been reading Marty Makari's book, Blind Spots. And in this book, Marty Makary is a surgeon who is on faculty at Johns Hopkins University. He wrote this book to highlight a number of widely disseminated recommendations by multiple scientific and medical bodies throughout the years that had weak evidence and have since been overturned. So let me give you a few examples. In the 1980s and 90s, there was increasing recommendations that parents not expose their children to peanuts early on because they might develop allergies. And that became a widespread recommendation. I remember hearing it when I was a child, and yet the science is strong to suggest that by doing that, we actually increase the risk of serious allergic reactions in children. Another topic that he covers is the link of hormone replacement therapy to breast cancer. So around the same time period, in the late 1990s and early 2000s, it was recommended that women not take hormone replacement therapy because of its link to breast cancer, and that's largely been overturned as well. So it's a book that I think I'm about halfway done maybe, and I highly recommend it. I'd also like to share a post on LinkedIn by Dr. Athena Hall. And in this, she describes an ideal community-based health model where different community members from healthcare organizations to others work and iteratively learn and adapt over time to improve the health of their community. Finally, some have asked how they can support me. I think really just by liking and sharing and getting notified of these videos. I am producing a video every day. That's my goal. And I will be producing these 5-minute daily health systems transformation conversations so that I'd like to contribute and further the conversation around health systems transformation. Thanks.